with that, let's get into how we use it in the gym now, because like anything else, people see a new technique or hear a new topic, they do little to no research on it, and then just go and take and try to put their own spin on it. And before you know it, you got people out there doing things wrong, incorrectly, all kinds of things. So see if we can kind of nip some of that in the bud here a little bit. I remember when I first moved to Boise about 2 or 3 years ago, I saw a guy in the gym that was putting them on his arms, doing his own workout with them on there. We're talking 20 minutes. Yeah. And I had tried to have a discussion with this guy, and of course, he's like, he was a big bodybuilder, so he didn't want to listen to me or whatnot. But I'm thinking, man, that guy just doesn't know what he's doing there. He can have some damage. So to a newbie out there, let's kind of break it down. What is the proper way to use it? And let's just go ahead and start with the arms. We've already talked about the arms a little bit. Let's say for the arms, kind of explain it a little bit.
Yeah, so you would take whatever you're going to use, your wrap or whatever, and place it at the top of your arm. So not at your shoulder, just the top of your arm. So even though we're talking about the arms, the only two places I would put the cup is at the top of your arm and the top of your leg. Mm-hmm. Even if you're doing calves, I would just put it at the top of the leg, just because of the amount of tissue that you have there, a little bit of a built-in spacing factor.
Under the knees there, man. That just, I'm thinking that's a little recipe for disaster there a little bit.
Possibly. Yeah, I definitely agree with you. But yeah, you put it at the top. Now, obviously in the gym, you're going to be applying it with a wrap. Mm-hmm. So the question is, how tight do I wrap it? And the first kind of recommendation that came out was wrap it at a 7 out of 10 tightness. And at the time, that seemed reasonable. Recently, it doesn't seem as reasonable for a couple different reasons. But I can explain that later. Sure. But basically, you apply it at the top. Now, the way I typically describe it is we want you to basically tighten it to where you feel some level of restriction, but it's not so tight that you're in pain before you even start. Mm-hmm. Right? Now, one of the things I think people can use as a gauge for how much blood flow restriction is occurring is how many repetitions that they're able to get. Mm-hmm. So if we use kind of a quote-unquote standard goal repetition protocol, where the first set is 30 repetitions, the next 3 sets are 15 repetitions, with around 30 seconds of rest to a minute rest. If you know that you are using around 20 or 30% of your max, right? And you start to exercise and you're not even getting close to 30, 15, 15, or 15, if you're not even close, then the wraps are probably too tight, right? Or the load is too high.
I'm glad you said that, because that's exactly what I tell my people. I'm glad you said that. Good deal. I was right. Anyway.
Yeah, there's no added effect to blood flow restriction with high load exercise. So all you're probably doing is increasing your discomfort. Right. So if you want to lift heavy, that's totally fine. I'm on board with that. I'm all on board with that, lifting heavy. But there's no use to put blood flow restriction on there. Now, if you want to use very, very lightweight, that's where you're going to see some of that benefit. Now, let's say that you get 30, then you get 14, then you get 12, then you get 9. That's probably fine. Mm-hmm. You're not always going to get all the repetitions, but you should be getting close. Now, if you apply the wrap and you're in pain before you even start, it's also too tight. You can also just check your pulse. If it's gone, it's too tight. There's no blood flow to the limb. That's how we test it in the lab. We have a Doppler probe that we place right here, and we're just listening to basically that blood rush. Gotcha. And if it doesn't hear that, then there's no flow. Oh. Mm-hmm. So there's a couple of different checks there that you can do. I like the workload thing because it kind of gives you an idea. Now, obviously, there's a wide range of pressures that you're probably going to apply day to day. Maybe one day you get a little bit tighter than the other day. Maybe you get a little bit less on the next day. I don't ultimately think that matters too much for a normal person. And the reason why I say that is when we think about muscle size, muscle strength, there's a range of pressures that seem like they give a very similar response. Okay. So if we do a very moderate pressure, where we apply 40% of the pressure that's needed to completely cease blood flow, or we go very, very high at about 80 or 90%. If we compare both of those, they give very similar adaptations.
Really?
Yeah, so the workload is going to be a lot different. It's going to be less with higher pressure, but they give a similar output. So with that in mind, I think it's okay. You have a little bit of a wiggle room. If you get one arm a little bit tighter than the other, it's probably fine. Especially, if you're a normal person. I don't think it's that important to precisely know the pressure. Now, if you're in a clinical population or you're in a research world, it becomes much more important.
Authority, yes.
But yeah, so I would say apply the cuff or the wrap at the top of the arm. I prefer narrow. I apply just, wrapping it over itself. If you have knee wraps that are super long, I just cut them, to cut some of the length off.
Yeah.
And apply it to where it's pretty snug, before you start any exercise, and you can notice a shift and some blood flow.
Oh yeah.
So you're not in extreme pain. And then I would use workload and do a little bit of self-experimentation. Now, the recommendation that's floating around by a lot of people, and myself for a while, was just use 7 out of 10. Now, the issue with that is that results in an extreme range of pressures, right? And it's even less reliable from day to day than I think using the workload, meaning that one day you might be at 90%, one day you might be at 10%. It's just not a useful scale from day to day, in my opinion. But
yeah, I can tell. I mean, of course, I've been doing it for a while. I can tell by the time I'm at my done with my first set, my 30th rep, whether it's too tight or not, or like you said, the weight, whatnot, maybe a little bit different. But when I'm working with a new person who hasn't ever done it before, I start off very conservative. Very, very conservative, kind of get them used to it, and then kind of have them build up a little bit to determine their level of tolerance. But question about that is, what about body fat? Because I know when I'm in off season, I seem to have to kind of crank it down a little bit more than, the last few weeks, in prep when I'm super lean and stuff. Doesn't take much tightness to get the same effect. Is there any research behind that, or just your general feeling on that?
Yeah, we've done a lot of stuff on that. Mostly it seems to be, what seems to be most relevant is the total size of the arm, or the total size of the limb, meaning that the bigger the limb, the greater the pressure that needs to be required to restrict the same amount of blood flow. The other thing that might be happening when you start getting into really lean prep, you have your arm size, unfortunately, is going to get down a little bit, right? Just because you're losing a lot of tissue.
Correct.
Mostly fat.
We hope.
Yeah. But it is getting we all know we can feel it in our shirt sleeve. Our arms are getting smaller. So that is a big player. The other component is your blood pressure also often reduces a little bit, which might also be something to think about. But yeah, the arm size certainly.
Okay, that's a good point. I didn't think about the blood pressure coming down, so that does make a lot of sense on that too. I think it may be a little bit of a combination of everything, but did not think about that one. Good point. So let's talk about exercises now, okay? Because I see people doing tons of different variations of things using BFR methods. Some of them, if I think about, like, okay, that makes sense. Some of them, not so much. We all know, well, most people should know, typical things when you wrap like between the shoulder and the tricep, bicep work, tricep work, it's going to give you really good advantages. Same thing with on the lower body. I try to wrap it right below the butt cheek, so to speak, and kind of high up as I can. So you'll get your quads, hammies, and calves in there. That's a pretty standard one, and typically using the cluster of 30 reps, 15, 15, 15, 20 to 30 seconds is usually what I've done in between. But you're saying you can go up to a minute too as well, though, right? In between.
Some people do. Okay. We always do 30 seconds, but some people do a little bit longer.
Any reason not to do it? Is there any like negatives or cons to that?
I think that the longer you leave it on, the greater the duration you are under restriction. So I don't know that it matters too much,
Okay.
but I
Kind of
always
splitting hairs a little bit there.
yeah, I always tend to go with 30 seconds.
Okay.
If we look at the, it's tough to know because they're never compared head to head, but
Sure.
the adaptations from those groups are the same things that we see using 30 seconds. So
Okay. Okay. So besides just the normal working sets that we're talking about, there are some ways to do things that you can have secondary benefits. And correct me if I'm wrong here. Let's do like a superset situation of maybe like a machine pressed and tricep work, something like that. Obviously, you're not going to get full benefit on your chest. However, if I'm wrapping the cuffs here, I'm fatiguing my triceps to the point it's almost going to isolate the chest more, giving me more of a workout in that respect towards the chest. Is that pretty accurate?
yeah, that's my opinion, and I agree with you. Now, I will also say that a lot of that is just connecting some dots.
Mm-hmm.
So how much data is there to connect those dots? Well, it depends on who you ask.
Mm-hmm.
If we look at some of the, so to your original point, everybody can make sense of how it would help distal, meaning that below the cuff.
Right.
Okay, that makes sense because it's under restriction. The
Mm-hmm.
biceps or triceps, the quads, hamstrings, everybody's on board.
And that's where most of the studies have been on.
Correct.
Yeah.
Now, what about the chest? What
Mm-hmm.
about the back? What about the shoulders? Those aren't under restriction.
Mm-hmm.
Yasuda, Tomo Yasuda from Japan, he's done some studies where he looked at bench press with blood flow restriction compared to the same exercise without blood flow restriction. And he found that muscle growth did increase a little bit more in the chest with the group that had blood flow restriction. Now, the question is, how did that happen, right? That should be, it's like anytime you see an effect like that, the next logical question is, why would that happen? Because it's not under restriction.
Kind of have to do like a little root cause analysis there to figure it out.
Yeah. So the thinking that he had is similar to thinking that I have, similar to thinking that you have is maybe there's something to fatiguing that triceps to where the chest has to pick up the load.
Mm-hmm.
So that would be how I would try and think about it. Other people try to think about it through a hormonal response. I'm not convinced on that at all. Mm-hmm. The activation thing makes a lot more sense to me, even in the absence of a lot of evidence to really demonstrate that this is it or that's not it. Mm-hmm. But to me, that makes sense. Doesn't mean it's true, but it makes sense to me. So with that in mind, I think that people who wanted to do that, I like the idea of supersetting it with something that is under restriction. Because you're fatiguing even a little bit more, and then you go back to that exercise, whether it's a shoulder press, whether it's a lat pull down, whether it's a bench press, with the idea that because I fatigue something that is under restriction, that may make these other muscles work a little bit harder than they normally would. So yeah, to me that makes a lot of sense. And there is some data on it, but not a lot of data on why that might be happening.
Yeah. I mean, I actually tried it myself. For example, I would go and when I do that, I usually will do it on like a chest press or something, just because of the safety aspect, obviously, unless I had a spotter. So I would actually go and do without any cuffs or anything, do like a cluster set, 30, 15, 15, 15, doing that and eventually work to a weight that I knew I could do that correctly. And then try to do it like a couple of weeks later, try to do it with cuffs on, couldn't even come close to finishing it. Couldn't even come close. My chest just gave out. By the time I was done, trial and error stuff, I had to reduce the weight by about 40% on the chest press before I was able to do it wrapped. Yeah. So there's something there, obviously, not to mention my chest burned a heck of a lot more doing it with a superset wrapped versus a superset non-wrapped. So there's definitely something there. And I like that a lot too.
Yeah, I've experienced something similar to that as well. But I do agree with you that, especially for the people that are going to be listening, if you were going to do the chest, I would superset it. Absolutely. with
I mean,
something that is with a muscle group that is under restriction.
correct. Same thing, like you said. If you're doing back workout, then do the biceps.
Yeah, yeah,
The biceps are going to fatigue a lot faster than the back, and you got more emphasis on the back.
yeah.
So let's flip the switch a little bit because you mentioned shoulders. Um, I've been doing this. A lot of people know I've been doing this. Now I'm kind of curious is to find out if there's really any effect. What about lateral raises? Just plain old lateral raises, because when we're cuffing it, we're not restricting any blood flow into the shoulders. However, I do feel a little bit of extra work in there. So I'm wondering if it's just because of the high rep, high volume that I'm doing, or if the cuffs actually, if there's any benefit to it doing the cuffs. What say you on that?
Yeah. First, I'm not sure. Second, my hunch would be is that it might just be an effect of just doing a tremendous amount of repetitions.
Mm-hmm.
It could also be that when you have a cuff there, maybe it helps you focus in just a little bit more.
I
You
do
have
do
like
that. I do that. I can more in tune with the muscle whenever I'm doing that. That is for sure.
so that might be something too. But if I had to guess, I would say that it might just be the sheer number of repetitions that you're doing.
Okay.
But I don't know. I've seen people do it as well.
Mm-hmm.
It's hard for me to think that blood flow restriction would be necessarily doing something with that, but I've never seen anything one way or another.
Not really any studies on anything like that.
No.
So what if next one? Okay, so we work with a lot of bikini girls. So if you had to say the best way, or if really is there anything that can give a good benefit to working the glutes per se, because again, that's going to be something that the muscle is above the cup areas. So any benefit that you can think of significance that we could do with that?
I have seen this before. I can't remember exactly what study or what the movement was,
Mm-hmm.
but I do know that the glutes have changed in some capacity. Yeah, that's tough. There are people who do it in combination with squats.
Uh-huh.
So maybe you could argue that it's able to augment something of that because you're fatiguing something else. But
something takes over, kind of like the
I really don't know, to be honest.
Well, we did do one with a friend of mine at our gym, Eric. We did it with one girl where we put her on what was it? I think it was some hip thrusts and things like that. And we measured, or should I say, he measured across the glutes before and after, and there was a pretty significant increase in the size. Obviously, pump can do that anyway too.
Sure.
Just the blood flow in there. There was a little bit of increase in the width around the glutes and stuff that came out to tell us something was going on there, but don't know if it was really from the training or the BFR or just the fact that we were getting induced blood flow in there from just normal, working the muscles and stuff. So I guess that's something that really needs to kind of maybe down the road we will know. But the more we're having this discussion, the more I'm thinking about it, the best thing that we can go off of in terms of where the data is just a plain old, anything below the cuffs, you're going to get your benefits. Maybe some stuff with some supersets if we're doing a combination like, tricep and chest, back and biceps. Might just be best to kind of limit ourselves to those type of things. Maybe 2 or 3 years from now, we might have a little bit more information on that. Is that about right?
Yeah. The work that has been completed on the practical blood flow restriction, practical meaning with the wraps that we've been describing, those studies actually, for the most part, have been done in athletes using the bench press and squat. And they have seen some benefits with strength. They didn't have really good measurements of muscle size, so that's hard to know. But yeah, I would say that the majority of the evidence lies in what you just described.
Okay, it's good to know. Still like to play around with a little bit of things, because a lot of times if you've been doing stuff long enough, you can kind of feel it a little bit to an extent. Yep. But then again, it could be that you're euphoric feeling or just that you're focusing on that muscle more. But I guess you could say as a secondary effect, if that's causing you to focus on that muscle more, you might be getting a little bit more benefit if you're starting to feel it a little bit.
Sure.
So let's change gears a little bit because I'm a little interested to know, we're talking about the practical sense in bodybuilding. Is there any other research you've been doing in terms of the physical therapy aspect of it recently?
Not me in particular. I don't typically work with. I'm not a clinician in any capacity. One of the things that we just finished up is kind of working on this idea of how to best apply the practical blood flow restriction. So, we've demonstrated that the 7 out of 10 might not be the best. And the reason why that's important, even maybe from a clinical perspective, is a lot of these clinics, you have limited time with patients, right? Because of insurance or a variety of other reasons. So a lot of what they're doing now is saying, here's what we want you to feel like. All right, here's blood flow restriction. Now go home and do this. So that's obviously some potential issues with if you're applying it with a 7 out of 10 tightness scale, because we've demonstrated that maybe that's not the best way to do it. So one of the ways that we've been kind of messing around with is the first way was just to apply a percentage of your arm size. So that seemed to compare very well with respect to blood flow reduction.
A percentage of your arm size. So just out of curiosity, are you talking like maybe from elbow to wrist or the full arm size, or?
No, so we'd apply the cuff, right? So we treat the cuff almost, it's going to be like this around your arm, right? Yours will be much bigger than that, but maybe here, right? And then
you're too kind.
let's say that's 20 centimeters or 20 inches or whatever.
Okay.
You take a percentage of that and then pull the cuff that length and then tighten it. So when we've done that, we show that reduction in blood flow is very similar to that observed using very sophisticated equipment. Now that's at rest. So we don't know what that looks like during exercise. We don't know what that looks like with training.
Okay.
So that's one area that we've tried to work on to best apply a practical stimulus. The second area is what we just finished up, and what I'm very interested in is this idea of conditioning someone. So we bring them into the lab. So let's say we have somebody get hurt, or they want to, for whatever reason, apply blood flow restriction, but they want to apply it with the appropriate pressure where they really absolutely zeroed in on it. Our idea was we bring people in, we repeatedly apply a correct pressure. So we say, this is the pressure that's correct. This is what we want you to rate. This pressure is too high. This pressure is too low. And we just keep doing that over and over and over again. So in their mind, the idea at least is we're conditioning them to know what that pressure feels like. So we've had some success with that. I wouldn't say a lot. So, but we're in the beginning stages of working on that. Can we condition someone to go, this is the pressure that we want you to feel, right? And we feel like that.
Whether it's too high, it's too much or not enough.
Right.
Very interesting.
So that, from our perspective, that's much better than going a 7 out of 10, because a 7 to you might be 90% pressure, whereas to me, it might be 5%. So that's quite a range. Whereas if we could go, let's condition you to 40% and me to 40%, and now we both know what that feels like. So that's a great idea on paper, right? Now, whether or not that pans out to where people can actually do that consistently, that might be a completely different story.
How to show somebody to do that.
Yeah.
But still, so this is something you're currently working on right now?
Correct. Yeah.
Very, very interesting on that. I have to say though, I probably go a little too tight sometimes because I actually enjoy the pain of it. It was not pleasant at first, but I kind of like it now. Like I said, I kind of have that euphoric feeling afterwards and stuff. So for somebody like me, I think I need to temper it back a little bit, because obviously I don't want to do any unnecessary damage or anything. Couple more quick questions here, because I know you're going to have to go, but is there any other rep range and set types other than the standard 30, 15, 15, 15 that would be benefit to do, or is that still the best?
Yeah, that's a tough one, because 30, 15, 15, 15 is the one that pretty much is always recommended. And it's recommended because if you do that, most of the time you're going to see something positive.
Mm-hmm.
That doesn't mean it's the best. It doesn't mean that that's the only one. That just means the one that produces consistent results.
Mm-hmm.
Now, in my lab, from a research perspective, I've moved to just doing 4 sets to as many repetitions as they can.
Mm-hmm.
I've done that for a variety of reasons.
No, let me wait. So 4 sets, as many as you can each
Basically to
time.
failure. Yeah.
Okay. Okay.
From a research perspective, I have a lot of reasons why I do that. If I was working with, if I was training someone in real life, I'd probably give them some goal repetitions of 30, 15, 15, 15,
Mm-hmm.
just to give them something to shoot for.
You track your progress, obviously.
Yeah.
A little easier to do that. Consistency.
So, but yeah, some people, you could do 4 sets to failure. That could be something that you mix in every once in a while. You could do the standard protocol. Some people use just 3 sets of 15.
Mm-hmm.
Yeah, there's a variety of ways that you could do it. Those are probably some of the main ones. I would, if I was going to mix it up, I'd do the failure protocol, and then I would do the 30, 15, 15, 15.
Well, I guess in a way, if you think about it, if you're doing it twice a week, and then one time you're doing the standard protocol, and then another one you're doing it to failure each time, it's almost like kind of like DUP, because you're hitting different rep ranges, throughout the week. I don't know. I'm kind of just thinking like outside the box there, maybe, but I kind of like that idea.
And it's tough because, most people on the 30, 15, 15, 15, they're probably reaching failure 2 out of the 4 sets.
Most time.
So it becomes maybe a moot point anyway. But I think that people having some sort of goal in their mind to shoot for might be useful.
I agree, especially newbies or something like that.
Yeah.
Goals are extremely important when we're doing that type of stuff. Okay, so let's talk a little bit real quick about what's going on internally, the blood and things like that when we're doing like metabolites, lactic acid. I've heard or read a little bit about a slight growth hormone increase. I mean, can you kind of shed a little bit of light on some of that stuff?
Yeah, so there's certainly a lot of things that go on when you exercise, right?
Mm-hmm.
A lot of other things maybe are a little bit more pronounced when you do the same exercise with blood flow restriction.
Mm-hmm.
Now, one of the things that we always have to keep in mind is, and I hear it in your voice of trying to always be skeptical, is just because something's changing, that doesn't necessarily mean that's the thing that's important for your ultimate outcome.
Mm-hmm.
So I think that there certainly is a large growth hormone response, particularly if you're doing a lower body exercise. It's not thought that that's that important for adaptation. Now, how might blood flow restriction be working for muscle size? You talked about when we apply the cuff, we're restricting blood flow. Mm-hmm. So blood flow is going in, it's reduced, right? Not a lot of blood flow is leaving the limb during that rest period, right? Because there's no muscle pump, etc. Mm-hmm. So you do have a cell volumization. Mm-hmm. So you have a cell swelling effect. In other words, well, that's the idea at least, that your arm is swelling, that may be somewhat reflective of muscle cell swelling. And because the muscle cell swelling is occurring, that might be important for changing synthesis, breakdown, etc. Now, that's an idea that we helped propose a while ago. There's not a lot of evidence to say that swelling is the mechanism. Mm-hmm. Now, that's very difficult to study. It's very difficult to tease that out.
Yes.
Because you always have kind of a cell volumization effect. But that's certainly an idea that's been put forth. Mm-hmm. Now, the other things that have put forth that might be playing maybe a more important role is with low load exercise, with blood flow restriction, you produce a lot of those metabolites that are normally produced, but they're normally flushed out, right? When we apply when we apply a cuff, they're trapped.
Yep.
Now, there's some suggestion, and I thought this for a long time as well, that when we pull those metabolites inside the muscle, that by itself is important for stimulating and signaling muscle growth. I'm less confident on that opinion. There's just not a lot of evidence that says that that's the case.
Mm-hmm.
Not a lot of evidence that says it's not the case, right? But I'm not that convinced.
Not conclusive.
Right. But what I do think those metabolites do is fatigue those cross bridges. So you recruit more and more and more muscle fibers. So that's where I think the metabolites are having the biggest effect. In other words, we're exercising, blood flow is going in, not a lot of blood flow is leaving. We're producing a lot of those metabolites that are normally flushed out. This time they're trapped.
Mm-hmm.
So they might be leading to fatigue of those muscle fibers. So instead of activating 30% of your muscle, you start to activate 40%, then 50, 75, 85, then you activate a large portion of that. So that's where I think that the metabolites are really stimulating that effect. Now, the reason why muscle activation is important is it's thought that for a muscle to grow, you have to activate those fibers for a sufficient duration of time. So if I lift a very, very light weight, right, I don't activate a large portion of my muscles. I don't need a large portion to lift 20% of my max. If I lift a heavy weight without blood flow restriction, in order to lift that, I have to activate a large portion of the muscle. Otherwise, the weight's not going to move.
Correct.
Right? So activation seems to be a big name of the game. And the reason why is once I've activated that fiber, I've started some signaling cascades. So let's say I activate 20% of the fibers. Within those 20% of the fibers, assuming that they're activated for a reasonable amount of time, they're starting to turn on those growth cascades, right, in each one of those fibers. Then you activate maybe 20% more, then 20% more. So by the time you get done, you've activated a large portion of the muscle, meaning that a large portion of your muscle is signaling to grow, which is what happens normally with just lifting heavy weights, right? So a lot of the questions are the mechanisms different between low loads and high loads? And I think that the activation, the mechanisms behind activation are probably quite distinct, right? Because you're approaching the activation a little bit differently. But once the fiber itself is activated, I think the signaling cascades are all the same. And I think the gene expression is all the same. And I think that because if you look at what happens in the time after exercise with blood flow restriction, the change in synthesis, the change in some of the E3 ligase, the change in satellite cells, all those patterns look very similar to what we see with high load exercise. When we compare them head to head with the gene expression response, there's a very nice study from Ellison and colleagues where they looked at the gene expression response to blood flow restriction with low loads and high load exercise within the same person. They had one limb do one, they had the other limb do the other.
I think that sounds familiar. I think I might have read that. How long ago did that come out?
Maybe 4 or 5 years ago.
Okay, I think so, because that's when I was really starting to get into it a little bit. Yeah.
And what they found is that once the fibers are activated, the gene expression response is very similar to that of high load exercise, meaning that when high load exercise induces a change in one direction, blood flow restriction changes in a similar direction. If it doesn't change, blood flow restriction also doesn't change. So that's one of the reasons why I don't think that there's some distinct growth signaling pathway between them. I think they're working probably through a very similar one.
So kind of tailor on that, because I mentioned about the growth hormone response to it. Question is it significant enough to really do anything or not? Because it kind of just like a temporary thing as far as what happens from it.
Yeah, the hormonal response in general, the growth hormone response is certainly dramatic. I think the question would be is, does growth hormone in and of itself, even if it was very, very high, does that stimulate muscle tissue adaptation?
And that's where I'm going with this.
Yeah, it doesn't seem to.
Okay.
But we also see other hormonal changes from exercise, right? So there are some acute changes. Now, Stu Phillips and a bunch of other really nice laboratories have indicated that, and not only indicated, but demonstrated that those short-term changes are very small and they're very short-lived, right? And that's why they probably aren't playing that big of a role with with exercise-induced changes.
Mm-hmm.
Now, the part that was very confusing for me for many years, when I came into grad school at about the time a lot of their really good work was coming out.
Mm-hmm.
And I remember listening to it at a conference. This is one of my first, maybe my second big conference I've ever been to. And I'm sitting in the audience. I'm listening to all these really people that I really respect. And I'm somebody at the time who really took lifting very seriously.
Mm-hmm.
Really took it seriously. Now, I still work out, but my focus is certainly different. But then
different. They changed.
I was zeroed in on
Yes.
bodybuilding and getting strong. And I remember these guys coming up to the podium going and showing some data illustrating that these short-term changes in hormones aren't important. And all I heard is that these changes in testosterone, all of this, that doesn't have anything to do with changing muscle size. And I just remember going, what are these guys talking about? These guys are crazy. And I just remember leaving, thinking to myself, I'm like, what am I missing? And then I'm like, there's got to be something wrong with that. There has to be. These guys are clueless. Because I've seen people take testosterone and see drastic changes. And
we're talking a big physiological range there on that type of stuff too, though.
Yeah, exactly. And that's the point. I was the one that was clueless because when we do a exercise, right, the hormonal response that we get is right here.
Mm-hmm.
So it goes up and it comes right back down very, very quickly.
Mm-hmm.
Now, when you take drugs, it's very, very high and it's prolonged.
Stays there, yes.
Yeah. So I was confusing a very short-term acute response
mm-hmm.
with people taking drugs. And that was my disconnect, right? So because I just remember being so confused by that. But they demonstrated, and we've got some data that indicates that as well, that hormonal response probably isn't playing that big of a role
mm-hmm.
with the exercise-induced changes and adaptation.
Okay, that's good information to know because that really answers a lot of questions, a lot of discussions that are out there, and I hope people take heed of this. So I know you're kind of getting time here. So if there is, say, 1, 2, or 3 things that you would want anybody to take away from this, and remember, our audience is typical bodybuilders.
Sure.
We have a few others, but that's it. What would you say the best gold nuggets from this discussion would be?
So some takeaway messages,
yep.
especially for the bodybuilding crew. First, Ronnie Coleman's the greatest of all time. Second, and so there's no question about the first one. Second,
okay.
I think
fair enough.
I think that it's important to remember that we're to use low loads.
Mm-hmm.
If you want to use high loads, that's totally fine. There's no necessity to use blood flow restriction, right? You don't have to use it to see quote unquote optimal adaptation. But as you described, it's a potential tool to
mm-hmm.
use to help you stay in a prolonged career, right? So use a low load, use a pressure that applies a moderate pressure, but not a super high one, right? We don't want to cut off blood flow completely to the limb. And you can usually detect that by how much work you're able to do. If you're not getting close to those goal repetitions, maybe it's way too high, right? Or the load is too high. But use a moderate pressure, use a low load, and just be smart, right? If you have some concerns or you have a family history of deep vein thrombosis, and that's something that runs in your family, right? Or you have your family is very susceptible to muscle damage.
Mm-hmm.
Yeah, maybe set that one out, right? I mean, don't increase your risk for something where it's needless. So those would be the big takeaways, and that this is a very acute stimulus,
mm-hmm.
not a chronic one. And if it's applied appropriately, it does not appear to increase the risk over just normal exercise.
Mm-hmm.
But it's important to realize that there are still people with normal exercise who are susceptible to blood clotting, to muscle damage, to extreme muscle damage, right? So I would say that, use a low load, use a moderate pressure, and, really think about things what you're doing. Like people put a lot of thought into their training program. Apply that same thought to this.
you're certainly not going to go out there and write a BFR training program where, that's pretty much all you do. Believe it or not, I've actually seen that somewhere before, where about 70% of the work was BFR all the time. But go ahead.
No, I think if all you cared about was muscle growth, I think you could do that. And I think I don't see any reason why you couldn't, because from just muscle growth, if you're training the muscle, you're maximizing that. I can't imagine that it would be too much different if you were to add high loads in conjunction with it. Okay. I think it might get very boring, right? To just
I don't know. I kind of like the feeling of maybe try that sometime. So I stand corrected on that one, but no, I get your point.
But the reason why I think that you probably have that opinion is because you are of interest in both muscle growth as well as muscle strength.
Correct.
So if you want to be very strong, right, and all you do is lift very light weights, right, with blood flow restriction, then you will get stronger, but not nearly as strong as you would if you were to lift heavy weights, right? And obviously, if you have people, and this is a lot of people are hybrids these days. They do a little bodybuilding, they do a little bit of powerlifting. If all you do is lift light weights with blood flow restriction, and you go to powerlifting, you're going to get smoked.
Yeah,
you're not going to be competitive. So I think if you're interested in both being really, really strong as well as increasing muscle size, then yeah, you might want to balance both of those. Okay. If all you cared about was growth, I don't think it matters too much if all you did was blood flow restriction.
Well, would there be an advantage to that just for the bodybuilder who's just looking at or not even the bodybuilder, just somebody who wants to put on a lot of size real quick? I mean, would there be any advantage of it, or would it be the typical bodybuilding program?
The only advantage I could see is that if there was, for some reason, you had someone who could not lift heavy weights, or they just didn't like lifting heavy weights.
Okay, fair enough. Or maybe somebody with joint issues, maybe.
Yeah, exactly.
The loads.
Exactly.
Okay. So there are circumstances that might apply, but not to the general bodybuilding population, whatever. Okay.
Right. If it was me setting up a program for myself, I may put blood flow restriction in there, but I would do a mix, certainly.
Exactly. One more thing too, because you did talk about if you have problems with deep vein thrombosis or something like that. Are there any other health conditions that if you had them, you might want to stay away from this? Because this is one of the things I planned on bringing up, but just totally forgot actually. So I'm glad you brought it up.
I think that for the average person who's going to the gym, who's able to withstand a lot of the stress of really intense exercise, I doubt it's that big of an issue, provided that they don't have some increased risk of thromboembolism or blood clotting.
Okay.
If you're dealing with someone who's in a clinical population, there's been some suggestion that if you have people who have some conditions where they might be overly sensitive to those metabolites, that might drive up their blood pressure response within a single bout of exercise. For a normal person, that's not that big of a deal. Okay. For certain populations, that might be a very big deal, but that's probably a population quite different than the listeners.
Okay.
But yeah, I think that the biggest one would be if you have, a family history of blood clotting, then maybe that's something that you really think about, right? Mm-hmm. There's been some suggestion of the sickle cell trait, right? Mm-hmm. Yeah. Where, if you apply cuff and you do cause some deoxygenation there, are you going to affect those blood cells, right? I don't know, but maybe that's something to think about, right?
They're safe and sorry.
Yeah. Mm-hmm. The other one that's often discussed, we don't really screen for this anymore because it doesn't seem like there's a tremendous amount of evidence for it, but there's people who've had a lymphedema, maybe they had cancer or they've had lymph nodes removed. For a long time, people recommended not taking blood pressure on that limb. Mm-hmm. Now, so I just went along with that recommendation. That's just something I heard, and sometimes it's like,
well, it kind of makes sense, really.
Yeah. But there doesn't appear to be a whole lot of, it doesn't appear to be a data driven. That doesn't mean it's not something that you shouldn't be cognizant of, right? Sometimes people are just overly cautious, and that sometimes that makes a lot of sense. So, but if you have that, then maybe that's something to consider.
Okay, very good. Now you give, I'm gonna wrap it up now. You give seminars and you go to conferences and you do speaking and things like that. Is there a place where people can go to find out where you're going to be speaking or anything, like a website or whatever?
Yeah, I usually are pretty. I post things on Facebook.
Okay.
I post things on Instagram. I'm most interactive on Twitter.
Okay.
At JP Loenneke. So JP and then my last name. That's where you find out, you know, on all three of those platforms, I'll post where I might be speaking or a lot of my students, you know, some of the papers that they've written out of our lab group, which is a lot. You know, I'm always very thankful about my students. I'm very very happy with the students that I've been able to work with consistently, because, you know, we're able to throw around a lot of ideas. So a lot of the work that I share is stuff that's been discussed not only by myself but as a group. So you get a lot of our, you know, the way we're currently thinking about things, and a lot of the work that my students have really worked hard on. So I share that on all those platforms.
So what I'll do in the description of this and the YouTube channel, I'll put those different avenues they can go to follow you and things like that. Because I'm always looking out for when you post things and whatnot too. Because, you know, we've had a couple of discussions here and there, you know, back through some Facebook, and I really appreciate all the guidance you've given me on this, and basically just what you've done for the whole community in general, not just from bodybuilding, but from a physical therapy, health perspective and everything. I mean, the work you've done is really amazing. I mean, I'll tell you right now, I'm a fanboy of you. Always have been. You know, I think the first time I reached out to you is when I went to Lane's camp, and that was the first one that you weren't going to because you had another engagement, man. I felt like, oh, shit. But anyway, thanks again for your time, Dr. Loenneke. Really appreciate everything you do. And I'll try to get as much information out there about your past work and your current work, because right now I think the biggest thing is getting the right information out there, because some people do kind of take some of the stuff and go in a different tangent. And I always worry about the safety aspect of it, or whether the work they're doing is beneficial when they just kind of put their own spin of things. So again, thanks a lot. I'm sure I'll be talking to you in the future. One of these days, I hope we get to finally meet you. I mean, you're Southern Boy, Mississippi. I'm from Texas, so I got to get back down to the South one day or another anyway. So thanks a lot, man. We really appreciate it. Honored to have you here as a guest.
Well, thank you so much for the kind words. And I really appreciate it. And I thank you for the opportunity to be on your podcast.
All right, fantastic. All right, guys, until next time, see you later.